Hello, this is Dr. Lewerenz from Longevity Health Institute here in Rochester Hills, Michigan. Me and my practitioners here, do functional integrative medicine, primary care medicine, getting to the root cause of your health issue. The thing I want to talk to you about today, and I mentioned here on our Facebook earlier, is the effects of anxiety, depression, and stress and insomnia and what that can do to your immune system. And I particularly want to talk about and mention one natural supplement that's very effective in anxiety and in stress responses and stressful situations, like we're all experiencing here in 2020 with this COVID-19 outbreak. So, what can anxiety, what can insomnia, and what can stress responses do to your body? Well, obviously, you know this, we all kind of common sense know this, but I want to tell you the importance of it is it can really impact not just your quality of life and your relationships and then your care for others, but also your immune system. So, anytime you spike cortisol or you disrupt sleep, where you make cortisol and you make a lot of restorative processes when you sleep, you actually affect your immune system. And when that happens, it becomes a vicious cycle. And this can put us into a lot of downward spiral as far as worry, legitimate worry, by the way, and fears and what's unknown, and then affect mood. And there is studies that have shown that just the disruption in sleep and stress effects can cause a whole cascade of other health issues, physically and emotionally and psychologically. So, we're living in a big unknown situation right now with COVID-19 and the pandemic. We are, quarantined. We're worrying about ourselves and health and our loved ones and health and our family and health and our jobs and the economy and paying bills and what's the future going to look like, and none of us really fully know that. We can make guesstimations and educated assumptions, and some of those might be correct, but it's the fear of the unknown. Funny thing is that most days are unknown. You have to keep that in mind. Worry actually just robs you of health and wellness of today. Now, from a psychological perspective, you have to remember that that's very important and impactful. You've had every day in your life so far that you've had a lot of unknown, and you just have moved through it and not really fully sat with it and appreciate it. So, keep that in mind, is that nothing's guaranteed in life. And, just like here in May 4th, 2020, with COVID-19, we will get through this. We will be stronger. It'll be different, and we'll learn from it. But it's also going to change us to some degree. But that doesn't mean that you have to live and stay in fear and unknown. Now, if your anxiety and fear is crippling and it's affecting your life, there are some things you can actually do in lifestyle and in supplementation that we promote here. And something that came to mind today because I was speaking with a friend and a patient of mine that is actually a lead singer of a rock band, very prevalent band, Grammy-nominated rock band called I Prevail. And he mentioned me in an article today in Psychology Today. You can actually read about it and look it up, psychologytoday.com. The article is on Brian Burkheiser and I Prevail, the rock band. And he talks about our journey from years ago, where I helped him, as I help other entertainers, in their health journey and getting mentally, physically, and immunity, emotionally right in their type of job and profession. And I helped him. But it came to mind today about anxiety and what we're living in with today, and also what we can do and what we can take to actually really help not just your anxiety and worry and help you sleep, but also what can impact your immune system. And there's one particular herb I want to pay attention to and spend time on, and that is the herb Relora. Now, you may have heard in previous videos me talk about, something you could take, and it's something that we're using here right now for a lot of anxiety and worry that can be helpful and beneficial. if on the natural supplemental end. And if you visit our website, Longevity Health Institute, we have a supplement shop. You can shop on there by using the password and log in health. And you'll find all these things I mentioned, like NeuroCalm, like magnesium glycinate, like Relora, which I'm going to spend some time on. I want you to understand about Relora because I've used it for 20 plus years. Very, very effective herb, very, very helpful and very safe, and helps many, many other things. And that's what I like, particularly in this situation. But Relora can be very, very, very helpful. But we have an anxiety sleep packet that we promote there that's been helping a lot of people because of the situation we're in with worry and anxiety. And I do believe in coming months, even as we get through these next months and maybe even a year or so of this pandemic, and we're doing better, and we've got better treatment methods and preventative methods and good care and more accessibility to testing and availability of testing and antibody testing and prevention, we're probably going to be left still with some of this anxiety and fear and worry, and left with some of the destruction that has happened because of this. And so Relora, I think, in taking some anxiety sleep beneficial things is going to really be impactful, especially if they're safe. So Relora, what is Relora? Relora is from a bark, Magnolia officinalis. Bark. It's natural. What I like about this is that it's in the natural context of something that's supplemental, that's for mood and anxiety and calming, that is not an amino acid. Not that amino acids like 5-HTP or GABA or L-tyrosine, phenylalanine, phosphatidylserine, these are all beneficial in mood enhancement and calming. But they're amino acids that sometimes can interact if you're taking other medication, and they also can interact if you're on like an SSRI like Lexapro or Celexa or Paxil or Zoloft or any of these antidepressant, anti-anxiety meds. So then it gets a little wishy-washy and mixed up. And I have patients on those. I do believe in those medications in the right situation for the right person. And obviously we do personalized testing so that we know who needs those meds and who should be on those meds and when they're appropriate, okay? And maybe when they're appropriate not to be on and tapered off of. But what's nice about Relora is Relora can still help those people that are on those medications and on antidepressants, excuse me. So Relora is great for a number of things. It has a very calming effect, and mostly because it can have the ability to lower cortisol in a stress response. So not only are you getting a lower cortisol or a modulated stress response effect that's helping you feel calmer, maybe help you with sleep, maybe help you with worry, but it's also bringing down cortisol, so you're going to get a more natural, normal immune response, okay? There's also some studies on Relora because of the calming effect that it does and is used for insomnia. And you can dose dependent. Usually we use 250 milligrams upwards of even 1,000 milligrams if necessary. And that's usually 1 to 3 pills or 4 pills at a time. You can taper these around or titrate these around, excuse me. Some people take them during the day just to keep calm and keep their adrenal cortisol levels smooth. Some people take a little bit more in the evening of Relora for sleep. And again, these are safe and titratable. Obviously, listen to your practitioner like myself or one of our caregivers or providers here, or your doctor. So do it under healthcare advice, but this is what we've found. The other thing is that Relora has been shown to help with weight loss, probably because it helps adrenal effects and cortisol stress effects. High cortisols, actually you'll trap more, you'll have a poor insulin response, and you'll trap more fat and have a harder time losing weight. So it can help with that. It's been shown to reduce blood pressure a little bit. And that's been a nice side effect that we'll see in some people that with stress, typically you get heightened autonomic response, heightened blood pressure, heightened heart rate. So Relora is actually really good for that. Relora is also shown to be a little bit anti-inflammatory and immune enhancing. Now, I believe most of these effects, or if you want to call them good side effects, are because why? It's really hitting the target of the stress response, which is the adrenal system and the high cortisol stress response, okay, the fight or flight response. So I like Relora for that. So, we have an anxiety immune packet, like I said, we put together. It's called NeuroCalm, Relora, magnesium. Magnesium is always great to calm you, particularly the glycinate and malate form. And then, of course, for sleep, which always helps everything good restorative sleep, is a little bit of melatonin. Again, you can find these on our supplement shop website, longevityhealthinstituteinc.com. And, Relora, if it's a high quality, again, very safe, I'd start at 250 milligrams, and then you can titrate around in use, but listen to your personalized practitioner provider to give you good guidance. But listen, we're going to get through this, okay? And we might have all started before, the COVID-19, a little bit of anxiety just due to high stress in life. I think it's really, really, really important, though, that you understand that, using something natural like this can be beneficial and also get you on the right path, and you may find that you not need it later. But Relora, an excellent natural supplement, and good sleep helps anxiety, and good diet and nutrition. Outdoors, getting some light, getting some exercise helps anxiety. Connecting with others, just if it's by FaceTime, video, phone calls, distancing, on your driveway, in your neighborhood, sharing a story, a smile, if you're a good safe distance from somebody. We are humans, we need love, hugs, connection. Okay, we can't be that close, but let's at least bring the connection energetically, and I think far enough away to not have a mask so you can see somebody's expression, but not too close. Okay, so make it beyond 6 feet, or else. So again, hopefully this is enlightening, and pay attention and listen to me in the future about Relora. It's not new. I've used it in my practice for a long, long time. Got a lot of benefits for anxiety and stress and adrenal responses. And I thought it was worth mentioning. It's something that I've used with Brian Burkheiser, like I mentioned, and how I was in Psychology Today, mentioning what the methods I used with Brian, and helped him with his stress on the road and touring and making an album and all those pressures and demands. Okay. So this is something that you could use, as well as your mindset, the mind-body connection, as I've talked about before, about meditation and yoga, and all these things all are impactful. But try Relora if needed, and hopefully this gives you some benefit and direction related to anxiety and worry, and mood. I'll be talking a lot in the future about mood and neurotransmitters and other psychology things, because I think that is going to be very impacting in our country right now after coronavirus, COVID-19. So if you would subscribe, follow us on YouTube, follow us on Facebook, because we're going to, and share this with others, because you are spreading good health, good messages with insight, passionately. I'm not going anywhere. My practitioners aren't going anywhere. We provide telemedicine daily, and we treat everything from coughs to colds, to preventative wellness methods, to building immunity, to hormone replacement. We have a 6-point model that builds a foundation that's best for quality of life, quantity of life, and prevention. This is Dr. Lewerenz. Be well.